Hi, I'm Dr. Veda. It's very nice to see you again. So, how are you doing today? How have you been feeling? Oh, okay, yeah. Is that outside or inside? Okay, let me just. Yeah, nothing outside. Is it both ears? Okay, yeah. Yeah, well, we can definitely take a look at that as well as everything else since you're here for your annual physical. So, definitely want to make sure that everything is a-okay. Other than the ears, everything good? Any illness recently? Sore throat, cough, fever? Okay, good. Yeah. And have you been to see your eye doctor over the past year? Okay. And dentist as well? Okay, good. Fabulous. Are you still taking medication? Okay, yep. And still on the 50 milligrams? Okay. And does that seem to be working as desired, or do we need to talk about increasing dosage? Okay, lovely. Yeah, we'll just leave it alone if it's working, so that's great. All right. So I'm just going to start by getting some vitals. I'm going to go ahead and put this on your finger, okay? All right. Set that there. And then I'll get your blood pressure. So if you just want to uncross your legs for me. Yeah. Yeah, I know it gets pretty tight. There we go, like a vice. Okay. Just gonna let that pressure go. Okay. Good. All right. So we have just 120/80, so your blood pressure is perfectly normal. Looking at your history here, it does look like you have family history of high blood pressure, but you're doing well right now. Any personal history of high blood pressure? Okay, yeah. No, I didn't think so. Just wanted to make sure. Okay. So just set that down for now. And I'm going to get your temperature as well. Okay. This is just going to go right under your tongue. Just go ahead and open up for me. Okay. Good, good, good. Thank you so much. 98.6, so you are not running a fever or anything. Sounds good. Okay, just get that off your finger. Oxygen saturation is at 99%, so we're good there. Vitals look fantastic. Okay. And I'm going to take a chance to listen to your heart and lungs. So right now, just go ahead and breathe normally for me. I'm going to listen to your heart first, okay? Get in there. Okay. Alright, sounds good. Now I'm going to listen to your lungs. You can breathe just as normal. Okay, good there. Other side here. Okay, nice deep breath for me now. In. Good. And other side. In. And exhale. Okay, great job. I'm going to come around and listen from the back. So I'll reach over you here. Okay. And nice deep breath in for me here. Fabulous. Other side. Okay. Good, good, good. All right. Lungs sound great. Okay. Now I'm just going to do a visual examination of your skin. I am looking for any signs of redness or illness. Also taking a look at the moles. You have a couple moles on your face. We do have measurements of them from last time, so I'll measure them again as well just to make sure we haven't had any changes, but everything looks good. I'm not seeing any issues with the moles, like any irregularities we need to worry about. With moles, we're generally looking for irregular borders, discoloration, so darker than normal, raised, stuff like that, but yours look good, so I don't expect that to be a problem. Have you seen a dermatologist? Yeah. Okay, well, I think these ones seem okay anyway, but I would definitely continue seeing your dermatologist regularly, especially if you're at any increased risk, which with your skin tone you might be, so. But it looks good for now. Coming down into your neck. That looks good. Arms look good. And can you just show me your hands and nails? Okay, fabulous. And no issues with your skin in any other areas that I haven't looked at? Rashes, itchiness, dryness, anything? Okay, yeah, just seasonal dryness. Yeah. What kind of lotion do you use? Do you think you might need a special lotion, or? Okay, so it's just managed well with regular lotion. All right. Good. Yeah, I just want to make sure that we're not getting into the area of eczema or anything, but I don't believe that is an issue for you from what you're describing, so that's good. All right, I'm gonna go ahead and measure your moles as well here, just to make sure we haven't had any suspicious growth in the last year. Okay, I'm gonna come in here. All right, this one. Okay, over here. Yeah, okay. Alright, so it looks like those are same size as last year. Nothing to worry about there. And let me just get some gloves on here, and then I will take a look at your scalp and start some of the other exams. Okay. Was it raining when you came in? Just drizzling, yeah. No, I think I heard some pretty heavy rain a little earlier, but I'm not hearing it right now, so maybe it's calmed down a little bit and you'll be able to get back to your car with no issues, hopefully. Okay. And I'll take a look at your hair and scalp. I'm just gonna come in here and okay. Yeah, your scalp looks good. I'm not seeing any dryness, redness, irritation, signs of alopecia or anything. I do see a little bit of product buildup, which is probably just from any products or conditioner that you use. Other than that, scalp looks good. Is it itchy or uncomfortable at all? Okay, good. Yeah, if that product buildup is irritating for you or something you want to take care of, I would suggest using a sort of clarifying shampoo or even like a vinegar rinse. You can find information about it online, but that should take care of that really quickly and easily. I'm gonna bring my hands forward from beside your head. Let me know when you can see them. Just look right at my nose, okay? Looking right at my nose. Good. And again, looking right at my nose. Good. Okay. And similar, but I'm gonna go ahead and bring my fingers in. So just look right at my nose. Keep looking at my nose. Very good. And again. Good job. Okay. Now look at my fingers. Good. Look at my nose. Look at my fingers. Look at my nose. Fingers. Nose. Fingers. Sorry. Nose. Okay. Good so far. I'm going to bring a light in. So I'm going to have you go ahead and look right at me. I'm going to shine a light in your eyes, okay? Look right at me. Light's coming in your eyes. Keep looking at me. You're doing a very good job. I know it's a little uncomfortable. Okay. Good. Good job. Now I'm going to just hold your eyelid very gently. I'm not going to tug on it or anything, but I'm going to come in here. Good. Okay. Good. And other side. Okay. Yeah. Eyes look good. Now I'm going to have you go ahead and track the light. So you're following the light with your eyes. Don't move your head, okay? Just following with your eyes. Good job. Smooth tracking. I'm not seeing any issues. Very good. Okay. Follow the pen in and out. In and out. Very good. Okay. Look at my fingers. Now look at the light. Look at my fingers. Now look at the light. Good. Now tell me when the light is at its brightest point, okay? Good. And again. Good. Alright, I'm going to cover your eye. Just looking into this eye. Okay. And then we're going to switch. Alright. Very good. I have a little eye chart here. Can you just read the top line for me? Just the top line. Good. Okay. Now can you read the third line for me? Yep. Good. The fourth line now. Good. And this last line. Go ahead and read this last line. Fabulous. Okay. What color is this? And what color and shape is this? Good job. All right. So eyes seem okay. No issues with vision deterioration or anything. You haven't been having issues seeing, night blindness, anything like that. Okay, good. Yeah, and I know you see your eye doctor regularly, so that pretty much takes care of the eyes. I do have a color wheel here. I'm just going to have you recognize a few colors. Can you tell me what this color is? Good. And this color right here. Good. How about this one? Good. And we'll do this one. Good. And last one for now. Perfect. Okay. That seems excellent. Now I'm going to take a look at those ears because I know you said they have been bothering you. So I'll just get in here first. I'm going to take a look at your right ear. Okay, just pull this back a little. Alright, yeah, the outside looks good, but inside it does look like you have a buildup of earwax, and it looks like you have sort of a wet earwax. Looks like it might be a little discolored too. I'd like to get a sample of that. Look on the other side too. Okay. Let's get in here. Yeah, similar similar with your left ear. I am seeing sort of a buildup of wet earwax. Looks like it might be a little discolored as well, a little brown. Okay. So I know you said it's been itchy. Has it impacted your hearing at all? Okay, yeah. Yeah, it seems like it might just be a minor ear infection. I'm not seeing that it's blocking your eardrum or anything, which is good. I don't think we need to do a full irrigation, but I do want to clean out a little bit and maybe test that earwax. I think we might have just a minor bacteria situation that could probably be cleared up with some antibiotics. You're not allergic to penicillin or anything, are you? Okay, good. No, didn't think so. So let me just grab a couple things. I'm just going to take this in and very gently swab your ears to get a sample. So I'll start again with your right ear. Just come in here and swab. Oh, that feels kind of good. Yeah. Sort of scratching that itch a little bit, maybe. Okay. Just get a little bit in there. Alright. Here we go. Let's get that in here for the lab. And we want the other side as well. So I'm going to come in here. Get in your left ear just a little bit. Good. Okay. Get that in there too. Alright. So I have that sample. I'll send that to the lab and we should get results in 3 to 5 days. I believe it's just a bacterial infection, so I am going to start you on an antibiotic and I can have that sent to your local pharmacy. You still at the CVS in Target? Okay, yeah. So that'll be available for you to pick up today. It is just an oral medication that you take once a day and you take it for 7 days. Make sure that you finish the dosage unless you have any medical issues. If you do have some sort of reaction, make sure to call me, but generally we only see that with people that are allergic to the antibiotic, which is not the case for you. So that should clear it up, but I do want to just do the tests in case. Should be okay though. Right. Now I'm going to say a couple words in your ear just to test your hearing very quietly, and I want you to repeat them back to me, okay? Rain, bedtime, sleep. Good. Pizza, muffin, floor. Good, okay. I think I got a little bit hungry during that second ear. That sounds good. I'm going to do a couple of very light snaps in your ear. I want you to count them for me, okay? Yeah, that's 3. 3, okay. 4 and 5. Good, okay. I'm gonna strike a tuning fork. Let me know when you can hear it. Good. Okay. Other side. Good. Yeah, it's a little louder. Good. Do you hear it moving back and forth? Yeah. Right ear. Left ear. Right ear. Okay. And you heard that pretty much the same volume in both ears. Okay. Good. Alright. Now I'm going look in your nose and mouth. Just come in here, look in your nose. Looks good. And open your mouth for me. Okay. Okay. Yep, everything looks good there. Throat looks good. No redness. Okay. And I'm going to touch around your face, okay? I'm just going to sort of palpate your face and neck. Okay. Let me know if anything is uncomfortable, okay? Just let me know right away. Shouldn't be, but... Good. Coming down into your neck. Okay. Just feeling your lymph nodes, making sure nothing is swollen. Good. All right. So, lymph nodes don't feel swollen. No sensitivity in your face. And we're just going to do a quick, sharp, dull test on your face. I'm going to put either side of this on you. One side is slightly sharp, one side is dull and covered in cotton. Tell me which side you feel, okay? It's not going to be painful. Dull. Dull. Good. Dull. Good. Sharp. Good. Sharp. Good. Sharp. Good. Dull. Good. Dull. Okay. Good. Okay. Can you open your mouth again for me and move your tongue from left to right? Good. Okay. Now I'm going to go ahead and try to close your mouth. Keep it open. Very good. Okay, now shrug your shoulders for me. Big shrug. Fabulous. I'm going to put my hands on your shoulders now. Shrug. Okay, good job. Shrugging against resistance. Alright, I'm going to come around and just do a couple taps on your back, okay? I'll reach over and do that. Oh. Thank you. We're just percussing to feel your organs. Okay, can you do a big smile for me? Good, and with teeth. Good, and a frown. Good, and move your head from the left to the right. Alright, no pain or stiffness or anything. No, okay. I'm going to put my hands on your neck. Turn your head again. Good, another way. Good, okay. Seems great. Alright. So the last thing I'd like to do today is do a blood draw, just because it's been 2 years now since we did your blood test, and do want to make sure all of your levels are okay. Is that all right with you? Okay, fabulous. Yeah. So we can actually take it right here, right now. You don't have to go to the lab or anything. Is that all right? Yeah, okay. I'm not worried about your cholesterol right now, so no, you don't have to have fasted. Probably next time we do this, I'll have you fast so we can check your cholesterol levels, but other than that, the fasting shouldn't impact any testing, so we'll just not do cholesterol this time, where that's not a history issue for you, and your weight is healthy range, seem pretty active. Okay, yeah, so we'll do everything else, but you don't have to have fasted to do the other stuff. All right. Just get that ready to go. Oh, no. Yeah, I do it all myself. We used to have phlebotomists, but sometimes I find it's just easier to do it really quickly while I have you in the room. just get it over with if you're nervous, and we don't have to prolong the agony. But I promise I'm very good and quick, so. Alright. So I'm just gonna get a little tourniquet for you. So I'm gonna tie this around your arm just so we can get your veins popping, get your blood flowing. Alright. Do you have a preference, left or right arm? Okay, yeah, I can do your left. That's totally fine. I know I usually do my right. I have better veins, but you should not be a challenge here. I'm gonna tie this around your wrist. Okay, just tighten that up really well. Good, good, good. And I don't want to show you the needle if it makes you uncomfortable. Okay, I'll keep that to myself. But I'm going to come in and we'll cleanse the area first. Okay. Good, good, good. And are you ready? Okay, yeah, no worries. Just a nice deep breath. It's going to be fine. It'll be over very quickly. We don't need very much blood, so. Okay, you ready? Okay, no worries. Yeah, we'll move at your pace, okay? So you're just gonna feel a little pinch, as they say. Here we go. Okay, we're in. You're doing a great job. Just gonna draw one vial. That's all we need. Okay, I'll take that little tourniquet off. Just put this over here. Okay. Fabulous. I'll just put some gauze over that. If you want to just hold that gauze there for me for a moment, I'll get you a band-aid, okay? Yep. That's all. It's really that fast and easy. Okay. I'll just stick a band-aid over that. Okay. Now, just give that 30 minutes and you can take it off when you get home, probably. Oh, okay. Yeah, well, maybe after you stop for lunch then. So that should be good. Okay. So, looks like a clean bill of health for you so far right now. I am going to set the blood sample out and we should get your lab results back in about a week. It will upload to the online portal. If there are any concerns, I will call you personally. Otherwise, your results will show in normal range and be in the portal. If you do want to talk about them either way, you can give me a call here. And I have sent that prescription for you, or rather will send that prescription for you to the CVS in Target. Do that right after you leave, so it'll be ready for you after you get your lunch. And everything looks good. We do not need to see you back for another year unless anything comes up, okay? All right. We'll also be in contact regarding the test results for your ears. I will call you regardless on that because it does look like there's something, though probably minor, and should be cleared up by the antibiotics, maybe even before we get the results back. But make sure to finish those so we don't create any superbugs, okay? All right. Any questions for me? Okay, well, thank you so much for coming in. It was really nice to see you, and I will see you next year if nothing comes up, okay? All right. Bye-bye.